Welcome back to Meds Made Easy. My name is Tarun Verma. Guys, let's get right into it. Let's talk about haloperidol today, also known as Haldol. It is an antipsychotic. It works by blocking your dopamine 2 receptors. Now, your dopamine 2 receptors are generally in your brain, several other places, and it mainly is responsible for controlling motor function, movement, things like that, which is why it's used in all types of behavioral disorders, hyperactivity in children, but different than ADHD, very, very different, psychotic disorders, and even Tourette syndrome as well. So getting back to the hyperactivity, it's more like kids who can't sit down rather than issues with focus. So it's a how do you call it, like a motor muscle dysfunction rather than a brain dysfunction. So let's see here. I won't go over dosages. It's just so variable and wide. It's just difficult to talk about. Comes in IV as well, so you can get injections. Injections change the whole game up. You can actually even take the injections IV, or you can get it in the muscle. Again, very, very different times at which it kicks in and how long it lasts. I'm just going to speak on the oral one, but the oral one generally lasts you anywhere from, I think it's 2 to 6 hours to really peak in your bloodstream. So, you know, it's not quick acting. If you have renal or liver issues, you let your doctor know, but generally this is pretty safe in both of those instances. Let's see here. I'm going to put up a list of side effects right here. This medication, because it can do anything from behavioral disorders to Tourette's to controlling hyperactivity motor functions in children, it generally means you're going to have a very wide side effect profile. A lot of different things can happen, and anything having to do with movement. So if your hands are shaking for no reason, your mouth, your face, anything is kind of shaking, moving around, movement that your body, that you're not controlling physically, that's generally probably a side effect of the medication. We're talking anything from issues with your eyesight to headaches to seizures due to like low sodium. A bunch of different things can happen. Likelihood of it happening very low, but it can happen. The common ones we had just put up there, those are kind of what you're really going to be looking at. And other than that, guys, I think that's kind of it with this medication. It's been around for a very long time. It's still used quite often in practice too. Again, it's not really your first line or second line therapy for a lot of different things now. You have other medications that can kind of do take place of that with less side effects, but this is still one that works really well. And so if you've tried the other ones and you failed on them, then this is worth trying and giving a shot to. A lot of people do see a lot of relief with this. We still see this commonly in practice. So guys, if you have any questions, comments, concerns, leave them down below in the comments. Give us a subscribe, let us know how we're doing. We're just trying to help with these videos, get everyone educated on the stuff they're taking. We're not instruments of big pharma or whatever. You know, medications, if you're taking it correctly, can help you. You incorrectly take them, they can harm you. So guys, that's it. Let us know if there's any other videos you want us to do, and we'll see you next time on Meds Made Easy. Bye.